Hello, everybody. Hi, and welcome to Health and Tech Now and Beyond. My name is Noah, and I'm going to be your host today. We're excited to welcome you to this healthcare and tech celebration. And we have a packed agenda for you with keynotes and panels and networking and interactive platforms. Please make sure to check out all of the pages on our site for more surprises. As you watch our live channel, please interact with our speakers using the chat on the right-hand side of the player. That's also where you'll find some interesting event announcements for us, so keep an eye on that one. You can also interact with other attendees using the networking chat at the bottom of this page. And if that's not enough, we have 4 virtual networking lounges, and they will be open on our happy hour, and I'll tell you more about them later today. So without further ado, I would like to introduce our first speaker today, Guy Spiegelman, EMEA Lead, Healthcare and Life Sciences Startups at AWS. Guy, the stage is yours.
Hello, everyone, and thank you to Kaltura for hosting us today and to our partners at Triventures, and welcome to what we hope will be a great 2 hours. Obviously, I think stating the obvious, we would all love to be there in person, but we're not. And we're going to make do with what we have. And I do really encourage all of you to at least give yourself this aim of, like, even though it feels a bit fake, try and network with 1 or 2 other people while you're here today. We need to make this effort. We don't know how long this is going to go on until we can have a real conference where we're all together and we can sort of be in the line for the coffee or the sort of the pastry. And start a conversation. So I do urge you to take advantage of this wonderful platform today and to really gain value, not just from the content from all my fellow speakers and hopefully mine as well, but also from each other. Because really I was discussing with a colleague today, I miss it and I think we all do. So let's make this effort and take advantage. So I have the real honor and pleasure of opening today. And I want to just talk a little bit about how Amazon and AWS can help you as a healthcare startup or a healthcare system sort of move on that journey to transforming healthcare, something that's become really quite urgent considering the life we're living alongside COVID-19. And so today I'm going to try and address a little bit about how the cloud can help and tools like AI and machine learning. And if you're a startup or a technology that's approaching healthcare for the first time, a couple of tips around how the healthcare economy works and how you need to cope with compliance and regulation. Just a tiny bit of background on myself. My role at Amazon and AWS is to lead our practice with healthcare life science startups and the investors that back them across EMEA. Before that, I was in venture capital in healthcare and life sciences, and I have a 20-year history in startups, starting in software and then moving on to healthcare and medical devices. So Jeff Bezos, the founder of Amazon, he said the following thing. He said, we had 3 big ideas at Amazon, and we stuck with it for 20 plus years. And it's putting the customer first, inventing and building, and being patient to see what happens. And really, that's what we try and do here. So we're done. AWS, for those who don't know, is the cloud computing arm of Amazon. We are the most comprehensive and broadly adopted cloud platform in the world, with over 175 fully featured services from data centers globally. Now, what you might know is that we've been around for 13 years, or 14 years now approaching AWS, but we have over 7 years of a dedicated practice of professionals from the industry, clinicians, researchers, bioinformaticians, bioengineers, investors from the field, with an average of 17 years experience each, who are here to look after you, the customers who are building solutions for the healthcare and life science industry, and here to offer you our global infrastructure. Job zero for us is security and compliance, making sure that whatever you build is going to be secure and comply with international regulations, helping you gain the advantage of advanced analytics and AI and machine learning. We have solutions for both the startup world and enterprises and the public sector, and a broad partner network that you can take advantage of. When Jeff Bezos talks about customer obsession, at the center of this all is really improving the human condition and looking at the patient at the center. But at AWS, we're not working directly with patients. We're supporting the healthcare systems, the providers, the hospital systems, the laboratory medicine, the home healthcare, the pharmacies. We're supporting governments, public health, regulators, payers, health plans, employers, the nonprofits, and the vendors, the healthcare IT, ISVs, the startups, the diagnostic companies, the medical device companies, the global system integrators, supporting you to support the patients. And that's really what we're obsessed about, helping you improve the patient, improve the human condition by making your solutions more accessible to patients. Now, we work with some of the largest companies in the world in healthcare and life sciences, and I'm taking examples for healthcare, from provider networks to payers to the US government, but also governments across the world, to industry, and many of its upstarts and many of the startups. So whether it's in medical imaging, like Viz.ai, or in consumerization or telemedicine like Babylon, Adherence, MediSafe, company out of Israel, digital therapeutics, a really exciting area. We support literally thousands of startups in healthcare to bring their solutions to market. Now, before going on and talking more about technology, when I started my first job in a healthcare startup, I had the privilege of working with an organization in the United Kingdom called Bupa. They're a large private health insurer, and they also run aged care facilities and wellness centers. And the chief medical officers there told me, look, we were setting up the healthcare business together, and she said to me, Guy, you really have to understand the 4 Ps of healthcare if you want to understand how to build a business in the healthcare market. And as we said before, patients are at the center. And I was a bit confused. What do you mean the 4 Ps of healthcare? And then she explained, well, okay, patients are great. This is who we're helping. And this is what we're doing to try and benefit, provide benefit to ultimately. But mostly, on the whole, and yes, there are some changes to that today, they don't decide what they're going to do, which service they're going to consume, or which pharmaceutical, which therapeutic they're going to take, and they don't pay for it. So we have these other 2 organizations, or groups of organizations, the providers. These are your doctors, your hospital systems, and the payers, and the people who pay the healthcare. And sometimes the payers and providers are joined as one, like in an NHS situation, or sometimes they're separate. We have an insurer on one hand and a doctor or a medical center on the other. So we have this kind of strange economy where the consumer doesn't pay or doesn't even doesn't deliver, doesn't decide the treatment. So I don't get to choose what I'm going to do, and I don't have to pay for it either. And connecting all that, and this is the 4th P, is the pathway. And understanding, and each healthcare system and economy is going to be quite different, how these 4 things work together. But understanding that pathway, and if you're a new technology and a new startup trying to approach healthcare, it's really important that you try and understand how that all works. So in terms of AWS and where our focus is, the sort of big themes, we have 3 sort of big overarching themes that we want to be able to unlock insights and enable data-driven, digitally enhanced healthcare. One is around IT cloud transformation. I won't spend so much time on that today, but the other 2 I will try and talk about a bit more, which is predicting healthcare relevant events using analytics, AI, and machine learning, and personalizing the health journey. From the digital front door, whether that would, doing a telemedicine visit or a digital therapeutic or precision medicine, all these personalizing of the health journey is something that has gone forward leaps and bounds, and we've seen a lot of that over the past 6 months as well. And the challenges we're hearing to reaching that sort of those goals from our partners, and this is, I think, some good insights to take away if you're a startup or another venture. These are challenges that we're hearing constantly from our healthcare customers. So if you're looking to approach healthcare customers, some of these challenges you might want to address. So value-based care, or care that is around bringing the right treatment to the right person at the right time, and trying to optimize costs but improve outcomes. It requires data-driven decision making, sorry. But what we're hearing is that we don't have the necessary resources to implement it. we're hearing a lot about physician burnout. And I think this has been in the news as well with the constant round the clock of treating COVID, but it's well beyond that. You know, physician burnout is the administrative burden, filling out forms, and sometimes your doctor will sit there and look at a computer screen rather than looking at you, and manual processes. And so we're hearing that a lot, and maybe technology can provide some answers here. The traditional IT model, it lacks agility. So just yesterday I was at a large hospital in Israel where I'm based, and they were saying how there are silos between the different departments, and the radiology department doesn't get the full medical information they need to provide a proper analysis of a particular case. There's not enough security, compliance, and availability. So, there's some cyber issues that we're seeing around healthcare, and those need to be addressed. And there are different levels of engagement in the organization. You might have some really advanced clinicians who want to push forward technology, but then the people responsible for the nursing staff might say, well, we don't have enough hours of training to train the nurses up on this new technology, so we can't implement it. These are real challenges that we're hearing. So like all industries and like all, thinking about transformation, we want to see how machine learning can help. And I speak to a lot of startup founders who are machine learning experts and come to me and say, Guy, we've got this expertise. Where can we apply it in healthcare? And these are the sort of areas that we think are really relevant. So it's improving the quality of care, revenue cycle management. It's a big issue, especially in the United States. And we'll be hearing from TaylorMed, who had some stuff to say around that later. Patient and population health analytics. If we take COVID, understanding who are the likely patients who are going to be most at risk for a severe reaction to COVID. If we know that in advance, maybe we can protect them earlier. Operational efficiency. We want to get the best bang for our buck in healthcare. How can we do that? Personal health information compliance. So if we're dealing with personal health information, we want to be compliant, and increasing customer engagement. So let me give you an example of reams of, there are 1.2 billion medical documents created every year with critical information trapped into difficult, and it's very difficult to extract the insights. And one of the things that we did is that we introduced something that we call Comprehend Medical. It's a service that is ready to go. It's with an API call. You can use it from today to understand clinical data within a text. Now, we're looking at the entities and relationship extraction, entity traits, but I think this makes it a bit more real. Here's a whole bunch of text that has clinical relevancy. And what Comprehend Medical can do, and you can apply it really easily, is you can just run it through Comprehend Medical, and it will give you the demographics, the disease indicators, and the therapeutics that are involved, and extract that and put that into a structured database. Now, we've taken that one step further, and like I said, it's a service that's available. We've taken that one step further. Before that, this is the Fred Hutch Cancer Research Institute said, when they need to run clinical trials, they need to find the right patients, and to go through the huge amount of documents is almost impossible. And just by running it through Comprehend, they can take something that takes hours down into seconds. We've taken that one step further now with something we call Transcribe Medical, which is essentially a clinician conversation with a patient that can be recorded. And all of that, instead of it's not even through text anymore, that just the recording of that conversation can then now turn into that structured medical data. And again, it's a service that we launched just about a year ago, and it's available.
All right, Guy, I'm going to quickly jump in and let you know that we are wrapping up. I'll give you kind of like to finish your sentences, and we'll wrap up and move on. Thank you.
Sure. So I'm going to just wrap up and say, I'm almost at the end actually. So two words about compliance. It's really important to build with compliance. And so if and just rest assured, if you're building on AWS, we are HIPAA compliant, high trust, and GDPR compliant. And the last thing I'll say is we have a special program run by a great team of startup business development people to help startups onboard to AWS, including, and I won't go through all of this, but just to let you know, we have $5,000 of Activate credits if you're a startup and you want to start working with us, and you'll get this information afterwards. And we'd love to work with you and support you. So thank you, and good luck for the rest of the session today.
Thank you so much, Guy. This is, by the way, guys, if this is interesting to you, you can check out and meet with Guy and the team at the AWS Networking Lounge. If you click on sponsors and then AWS Let's Chat, and you would be redirected to their networking lounge. I know that some of you also have some one-on-one meetings with Guy and his team, and I'm sure that they'll be very, very excited to meet you and speak with you. So now, all the way from the West Coast and Israel, our next speakers are Dr. Peter Fitzgerald, Managing Partner of Triventures and Director at Center of Cardiovascular Technology at Stanford University, and also Netali Nadivi, Partner at Triventures. So without further ado, Peter, the stage is yours.
I think the three most common words in Zooming these days are please unmute yourself. And usually it doesn't start with please, but can everybody hear me?
Loud and clear.
Great. And how about the screen? Are we sharing that?
Start your screen share and we'll see that.
Yeah, I did. See if it comes.
There we go.
Good, terrific. Well, thank you, ladies and gentlemen, for the opportunity. Good morning from Palo Alto. And I guess I'm going to just start by giving you a little history. I had the opportunity to go to engineering school before medicine, and it was primarily in electrical engineering and computer science. And then as I went through medical school, maybe understood better how to apply some of the things that Guy's talking about with respect to the patient journey, with respect to disease modulation. And I think that's been a tremendous opportunity or honor to be able to see both of these worlds collide. And I have to tell you, ladies and gentlemen, after doing 25 years of medicine, I've never seen a change in healthcare that we're seeing today for sure. So let me just share with you let's see if we can get the slides to move. Okay, slides aren't moving. What should I do? There we go. So the broad nature of applying technology to healthcare is not just for the journey of a given patient, but temporally over time. For preventative healthcare, for unfortunate people that do have chronic diseases, and for longevity care for the elder population. It's really important, folks, that we talk about not just patients in healthcare, but people in health. This is going to be one of the largest areas that healthcare has ever seen, estimated to be over $500 billion by the year 2025. And the opportunity here is the coalescence of disciplines, not just the standard life science folks, but folks like Guy and other organizations that can really help us characterize disease modulation as well as patient interaction. We're being brought to you not just by the hospitals, but at retail health, often at home, and some of these intermediate institutions. And we're seeing the entertainment folks begin to come in because those folks know how to move a different population than we do in life science. And again, that whole spectrum is incredibly important. And again, I've never seen such a change that's ongoing today. So let's talk a little bit about perspectives. What have we learned in the last 100 years from the last time when we saw such a amazing impact globally? Well, first of all, there's a tremendous amount of chaos. And most of the folks that are mathematicians enjoy chaos because that nonlinear dynamics generates models that can potentially be predictive as long as your sample size is large enough. Let's talk about that heterogeneity for a minute or so. United States has 150,000 deaths today from COVID for a population of 325 million. South Korea has 300 deaths for a population of 50 million. Vietnam has no deaths for a population that's 10 times that of Israel. That heterogeneity in geography, in age and comorbidity, the ability to have an immune population growing in these focal areas called herd immunity, and of course, waiting for a vaccine that I guarantee you will not be available to the mid-2021. So we have to learn what to do, and we have to learn from what we've seen in the past. First of all, this is an RNA virus. It's called an H1N1. H is just the type of glycoproteins that are on the outside. It stands for hemagglutinin. N stands for neuraminidase. Again, that was what the Spanish flu was, which, by the way, is not from Spain. It's from, most of the historians think it's from the United States, specifically Kansas. We've seen the same things that we did 100 years ago. That is the gradient between science and politics. And it, for sure, is what we're seeing in the United States. The second wave 100 years ago killed 50 million people. 50 million people worldwide died for a population that's 1/6 of what it is today. And finally, we saw very different epidemiologic characteristics because the young were primarily targeted. That's very different than what we're experiencing today. Today, we have a lot of virology knowledge. We understand mutations, transmissivity. We have lots of antibiotics at our disposal to treat patients. And most importantly, as Guy has pointed out, we have technology for communication, information, and testing. And this is how we are going to defeat not only this virus, but some of the other viruses that we're going to encounter in the next decade, for sure. We've learned to control the number of deaths by flattening the curve so that we wouldn't run out of resources. The problem with this is that we've traded off short-term mortality for long-term morbidity. We're going to have a massive economic burden for years. The amount of mental health, drug abuse, family abuse, violence, suicides is going to be with us for a lot longer than we think, and is probably going to be the biggest tail of this process that we're going to experience it. Nursing homes, jails, schools, arenas, NFL, which we make a big deal about in the United States, all these are going to be massively impacted. But the ability to combine some of the technologies that we have, some of the things that Guy was talking about, is where the opportunity is. And that's what is burdening and what is necessary for all of us to participate in. The Zoom effect of healthcare, nobody wants to go to the hospital. They want to go to private outpatient clinics or retail health like Walmart, Superfarm, Walgreens. We're going to see remote therapies such as Mazor, Intuitive, be done at a distance, not just 9 feet away, but 900 miles away. We're going to see data-driven triage for those before they go to the hospital, while they're in the hospital, and when they rehab after the hospital. And we're going to enjoy all these digitization technologies of healthcare on one side, but we have to also understand that it makes us very vulnerable with respect to our networks in a hospital, as well as our implants in the IoT arena under this new 5G age of communication. So let's talk about the 3 areas: medtech companies, life science companies, and IT companies, and how some of this amplifies these particular bases. Well, when you add a service to a medtech company, you're able to do machine learning to optimize patient care, right patient at the right time for the right therapy. That's an incredibly important component, one that we have not been very good at because of the variability in how we deliver healthcare. And that's a very important issue. And there's many, many startups, as Guy has talked about, that are combining those services. In the life science area, the pharmaceutical area, drug discovery, clinical trials, pre and post market assessment is going to drastically accelerate, like we're seeing now with the COVID vaccine. These solutions coming to maturity, and the IT companies are going to have to learn something from the medical folks, and that is around the clinical situation and in particular the workflow. You cannot just come up with a better technology; it has to integrate into the workflow in a somewhat oblique way, but not to change the underlying baseline. And that is why it's an important area for all of us to work together. Let me give you an example, and Guy touched upon this. We hate EMRs. That's where we keep all our data for the patients. Sometimes we think it stands for an excessive means of reprimand because it is very frustrating. And as Guy pointed out, very often I'm looking at the screen rather than looking at the patient because I have to get that information into the EMR. What we want to do is actually have the doctor go back to compassion and caring and look at the patient. But in order to do that, that conversation has to be captured, as Guy pointed out, with natural language processing so that it can get structured, be curated, and get put right into the databases. That is a quintessential example of a component of how technology can facilitate, standardize, and decrease the variation of healthcare. Another example of a technology is using the energy from a certain wavelength from the front part of your camera on your cell phone and use that to elucidate the enzymatic reaction with, say, a nasal swab to see if, in fact, you have the antigen for COVID. This can happen on your cell phone, and it can get you an answer within 9 minutes. You can repeat it daily if you'd like. It not only recognizes whether you're positive, it is able to track. And this is how we're going to put out the campfires instead of closing down the whole forest in the future. And again, this is brought to you by a collision of engineers, information technology folks, and how to integrate this in the necessary areas for our healthcare stream. So these sensors, these algorithms that you've seen, whether it's reading a chest x-ray quicker, reading a pathologic specimen faster and more efficiently than a doctor, that service that can be brought to you by telehealth as well needs to be in association with the healthcare provider in order to go to that solution. And as you go to that solution, you collect data, full circle. But remember, you cannot take the healthcare component out of it. And this is what the FDA likes. The FDA, we call it actually intelligent augmentation, IA, instead of AI. They get scared about things like autonomous and automatic. So we never take the healthcare profession out of these services. We just augment their intelligence. And that's an important issue for engineers and data scientists to understand. One of the most important issues when you're looking at colliding technologies with applications in healthcare is you have to see how the business is going to scale and how it's going to be economically feasible. So you have to figure out who's going to pay for these services. Well, hospitals and patients do not pay. Do not rely on them appreciating what service you're going to bring into healthcare that they will pay. Now, payers and governments do pay. They don't pay as much as you'd like, and they don't generally pay on time. But they are a source of revenue. The three groups that really do make up an accelerant to bringing that technology into healthcare and is appreciated from not only an economic standpoint, but a workflow perspective is pharma companies, employers, retail health. Employers want to have their employees at work, happy and healthy. That really makes a big difference with respect to their work product. So again, pay attention to not only how it integrates into the workflow, but who's going to pay for these technologies. So the convergence in conclusion in health from what Guy has talked about and the expertise that he and others bring into this arena are quintessential. Data are the key to decision acuity at home, within the hospital, and some of these intermediate care facilities. It's data that are going to help us with that patient journey or people over time. Technology, tracing, triage will not only be important for virus outbreaks, but it's going to be important for disease modulation going forward. Respectful surveillance will be key from the young to the elder. The young don't care that much these days that they're being followed all over, but we have to be very respectful to our elder and how we're going to make them or allow them to have dignity, to stay at home longer. But definitely, ladies and gentlemen, a new generation is budding. The collision, the convergence of data-driven disciplines, of engineers, of IT folk, just like what we heard from Guy, with healthcare is one of the biggest things I've ever seen in my career, my 25 years of practicing medicine. And I look forward to more and more conferences like this, hopefully some more in person, but this is an important epic that we are on the verge of and beginning to integrate into healthcare. Thank you for your attention. And before I log off, I just wanted to, not log off, but leave the screen. I wanted to introduce my partner, Natalie. She's constantly making me look better because she's smarter and has a lot of experience in healthcare, worked with many, many startups, and is really one of the fulcrums to what we do at Triventures. And I'm very proud to stop sharing my screen and let Natalie take over. Thank you.
Thank you, Peter, and thank you so much for waking up so early for us. And I'm going to just switch over and share my screen. Okay, are we, hang on. Are we good?
Almost. We can see your kind of back end. Maybe you'd want to present. There we go.
Good? Okay, great. So apologies to the audience that you guys are not on your summer vacations, traveling around the world, but hopefully we'll make these couple of hours interesting and help the time fly by a little smoother. So I'm just going to spend a few minutes talking about Triventures and how we think about convergence and its potential impact on the industry. We are a venture capital fund based in Israel and Menlo Park, largely focused today on digital health. We see about 700 deals a year, and important to note in this forum, we're actively investing in seed A and B rounds. We've created an exclusive partnership with Sheba Medical Center, one of the top medical centers in the world. And around this partnership, we're able to leverage the valuable health data asset that's been accumulated there over 2.5 decades. We work very closely with the entrepreneurs that we support, but we also work very closely with the industry. And this slide is just a sampling of some of the groups that have joined our fund as investors. This is really core to the DNA of Triventures. We are big believers in working with the industry, both at our LP base as well as beyond, groups like Amazon and their peers. And for us, this is really value add both at the fund level and the portfolio. It really keeps us in touch with what's happening in the field. Many of these groups actually started with Triventures over a decade ago with the earlier focus the fund had in medical devices, but most of them stay with us and join us now because of the focus on digital health and their need to undergo digital transformation. So in case people didn't get the memo, healthcare is really complicated. And most people would agree that this is an industry that has been ripe for disruption for many, many years. And some of the criteria that position an industry for disruption is that consumers don't trust the current system. So patients, there's a lot of technology available, but it's underutilized. Products and services are not affordable for the general population, and inconvenience is at an all-time high. And this is, I think, healthcare really ticks the box on all of these. And so when we talk about disruption in the context of industries, well, it's a very harsh term, an aggressive term. Actually, the intention is to have a very positive outcome. So do things in a different way that will produce something much better, much more valuable and efficient. And we really believe that in the last couple of years and going forward, a lot of the disruption in this industry will come from convergence. And when we think about convergence, we're talking about cross-vertical plays such as fintech for healthcare, cyber for healthcare, but we're also talking about the merging of new skill sets and expertise that has been accumulated in other domains, bringing it into healthcare, adapting it, and driving value in this industry. And with an industry ripe for disruption and the opportunities available in convergence, we can really begin to affect transformation in this industry. So healthcare is tricky. I'm not going to go through each one of the bullet points on this slide, but the point that I wanted to make here is that putting the pieces of this puzzle together, and it is very different in its behavior from other verticals that you really need to be aware of early on in your journey as a healthcare entrepreneur. But really what will help to put the pieces of this puzzle together are holistic, out-of-the-box thinking. And again, we really believe that what will drive a lot of this putting the puzzle together is convergence. And this has become really a core part of Triventures' investment thesis, where we're investing and looking to invest in the best in class of solutions that combine health and non-health solutions to create new markets, products, and services, and increase accessibility to those services. And just to check myself as a sanity check, I wanted to make sure that we're practicing what I'm preaching here. And one of the facts that I wanted to share with you is that more than 70% of our portfolio founding teams do not have a clinician as part of the founding teams. Now, I don't say that in any way to say that clinicians are not important. They're crucial in many cases. And if they're not part of the founding team, then often they're part of the extended management team or advisory board. But the issue that I like to emphasize here is that many complex healthcare problems can be solved and addressed from a different perspective and not necessarily through the clinical lens. And this is really a shout out to the audience and the participants in this event, that the fact that you may not have specific healthcare experience does not necessarily mean that you can't solve some of healthcare's biggest problems. So the best way to demonstrate a thesis is through example, and just quickly, I'm going to talk about a few of these before we move into the panel later in the session, in the event. So GENOMICS is a company that has developed a proprietary platform to analyze complex genetic data in the cloud. Very robust enterprise solution addressing multiple disease states, deployed around the world in multiple centers, and very successful. But what they've done amazingly in the last year, under a year actually, is built the first professional genomics community in the world. And I don't know about you, but when I think about companies that are community oriented or network oriented, I think of companies like GitHub, Reddit, LinkedIn, Twitter, not healthcare companies. And apart from the phenomenal data that's running through this community and the ability to resolve previously unresolved cases, again, the point to emphasize here on convergence is that the capability to do such a community in a very complex segment in healthcare, maybe one of the most complex, is really a credit to the team and their previous experience outside of healthcare. So they looked at best-in-class models in the tech industry and said, how can we replicate that, mimic it, adapt it, and drive real value in this complex healthcare space? Another example is LinksMD. This is a company that's developed a platform to connect data providers and data consumers, a big problem in healthcare. We won't get into that right now, but what I like to emphasize here is, apart from the fact that Links has selected a very unique technological approach to address this problem, which is very scalable and can be implemented very quickly, what is really interesting about how the company is approaching the market is at every stage of engagement with a customer, they're constantly thinking about how to reduce friction, from lead generation to first customer interaction, to proposals, to demos, to contracting and deployment and customer success and expansion. And they brought this way of thinking from their previous backgrounds in SaaS companies and enterprise software companies, and have taken that model, which really reduces friction at every stage, which shortens the time to decision, which enables quicker implementation, quicker value for the customer, and eventually quicker value for the company. And have taken that model that they acquired outside of healthcare, adapted it and implemented it, and are continuously refining it for this domain. And this really helps them to have a competitive advantage against their peers. The last example I wanted to share with you is MediSafe. MediSafe is a medication adherence platform. Started out as a B2C company, so enabling consumers to manage their meds directly. And over time, what MediSafe has been able to do is create a very successful business selling the insights to pharmaceutical companies. And again, founders that didn't come from healthcare specific backgrounds, but when they started the journey, looked for where the money trail was. And the money trail, as Peter also mentioned in his presentation, is with payers and pharma. And in order to create that value for the pharma, they knew that they had to crack the code on engagement and really have the best application out there that encourages users to enter the platform multiple times a day. And today they're managing billions of data points and doses on their platform. So that is where I'd like to conclude. And just, again, a shout out to the crowd. We really are big believers in this space. We think that if it was a high potential and high growth area before COVID, now the opportunity is much greater. And if you're in the space already, thinking about it, first-time entrepreneurs, second-time entrepreneurs, we would really encourage you to reach out to us. We're very visible online and can be reached across the team. So I will now hand it over to Noah so that we can move on to the next part of the event.
Yes, absolutely. Natalie, thank you so much. And thank you also, Peter, for a very inspiring talk. I know that we're running a few minutes late, but that's okay. We're just going to push everything slightly forward. And with that, we're moving on to the next main event that we have today, which is our startup panel. So focus here, guys. Please click on the message on the right-hand side within the chat, the right-hand side of the screen, and join us there. We're going to see you very, very soon. Thanks.